Okay, today, as part of the Bladder Problems Month, I'm talking to Dr. Susie Unsworth. Susie, would you
Hello.
like to introduce yourself?
Hi there. Yeah, so I'm Dr. Susie Unsworth. So I'm primarily trained in general practice, but I have a strong focus on women's health. And urinary problems are something that I used to see quite frequently working in general practice. So hopefully I'll have some advice on things that might be able to help.
Excellent. So we're going to talk about incontinence generally, really, and
Hmm.
I think it's one of the symptoms that people are often quite reluctant to talk about. So
Yeah.
hearing
Yeah,
your viewpoint as a GP is really useful. So
sure.
tell us how you would sort of go about speaking to people about it.
Yeah, so I think you're right. I think urinary problems are really common, and I think women often do put up with them for quite a long time before they actually end up coming to see me to talk about it. I think part of it is, I guess it's not a serious life-threatening thing. It's you can put up with them, like we were just discussing earlier. There are products you can just buy from the pharmacy, pads and things that help you just put up with it. And so a lot of women probably think, actually, I'll just do that, but there are a lot of things that you can do to help. And I suppose when I see someone initially, I would often try and encourage them to think about ways in which they can help themselves at home to start with. So I think one of the biggest things to think about is what sort of triggers are making the symptoms worse. There are different types of incontinence, and I'll maybe discuss those a little bit in a bit more detail shortly. But overall, there are things that can make all urinary symptoms worse. And the things that I often think about are caffeine, alcohol, and fizzy drinks. These are all things that do irritate the bladder. So whatever sort of urinary problems you might be having, if you're using a lot of these sort of drinks, drinking a lot of alcohol, taking in a lot of caffeine, those things are all going to make most urinary symptoms worse. So the first thing I would often say is have a look at what you are eating and drinking, and see if there are things that you could cut out to try and help improve things. One of the other things to think about as well is, interestingly, to think about bowel problems. So actually, if you've got constipation issues, often that can make urinary symptoms worse. And again, it's something people probably don't really like to talk about. But if you can manage those symptoms by, making sure you're drinking plenty of just fluid, but also keeping your bowels healthy and working well with things like fruit, fibre, that sort of thing. Because if you've got constipation, then you're often going to have urinary symptoms alongside it. So both of those things are sort of simple things that you can look at in your own lifestyle and see if they might just help improve things. So that's kind of the first thing I would often try and talk about with someone if they start saying they're having urinary problems.
Yeah. So you were saying there's two different types of incontinence. What are
Yeah. So I guess we sort of classify them into two things, but often people can have a mixture of both. But the two things that we're really talking about is whether someone's got an overactive bladder, and this sometimes is known as an urge incontinence. So this is where you get that kind of sudden comes over you, oh my gosh, I need to get to the toilet really quickly. And in some women, it can be so bad that they get very little warning and they just can't make it to the toilet in time. One of the classic examples of this is when people come home, and they used to call it latchkey incontinence. And it's where people kind of get to their front door, put their key in the door, and that is some sort of stimulus to make them recognize they're at home so they can go to the toilet. But it's so quick that often they just don't make it in time. So that's kind of what we call an overactive bladder. And that's usually due to the bladder muscle being a little bit unstable, sorry, and it can contract by itself involuntarily, and that contraction can sometimes be so strong that actually it makes you pass urine involuntarily. The other condition that we're talking about is more of what we call stress incontinence. So this is the classic one where you cough or you sneeze and you leak a little bit of urine. Anything that raises your intra-abdominal pressure can trigger this. And it's often due to some sort of weakness in the pelvic floor structures, so that the muscles supporting your bladder, the neck of your bladder, which are involved in helping control your waterworks, are not strong enough. So when the pressure from above is increased, the strength of the muscles down below are just not strong enough to prevent a little bit of urine leaking out. So they're the two kind of groups of incontinence problems, but often women will have a mixture of both.
Yeah.
So what, as a doctor, what we try and do is maybe work out which is the predominant symptom. So is it predominantly an overactive bladder, or is it predominantly a stress incontinence? And we would tend to focus the treatment initially on the predominant symptom, but then obviously looking at both elements of it if it becomes an ongoing issue.
So if someone's looked at the dietary changes and the sort of
Yeah.
the basic lifestyle stuff, what would be the next line of treatment?
Okay, so if I'm seeing someone in my surgery, I think the first thing I'd want to do is have a discussion with them about the symptoms they're getting, and like we were saying, work out what the predominant symptom is. If it was something that had suddenly got a lot worse, I might want to think, well, is there something else that's triggered this? So I would ideally want to examine any woman who's complaining of urinary symptoms, and I'd want to do a physical examination, sort of pelvic examination, to make sure there's nothing that could be contributing to it. And also check their urine with a dipstick to make sure that they haven't got a new infection, because if their symptoms have suddenly got worse, then sometimes that can be because they've got a urinary tract infection, and they are common. The other thing that's helpful to do an examination is just to check the tissues of the vulva and the vagina, because often vaginal atrophy, which is related to perimenopause, can often make a lot of urinary symptoms worse. And I think with all women, it's worth thinking about whether they would benefit from some estrogen supplementation down in their vagina and vulva to help with the tissues. And I would say that with both types of incontinence, making sure they've got a healthy vulva and vagina is actually really important. So vaginal estrogen, I think, is a treatment that I would recommend for a lot of people.
Yeah.
But then I suppose there are specific treatments that would help with the two different types of incontinence. So I can go through a little bit of those.
Yep, that'd be great. Yeah.
So if we're thinking about stress incontinence, because we're talking about the sort of strength of the muscle pelvic floor, the biggest thing there is really to think about physiotherapy. And you've got to be a little bit careful, because I think a lot of women sort of say, oh yes, well I do pelvic floor exercises. But it might be that they're not actually doing it effectively. And so the guidance for us as doctors is, it's not just to say to someone, oh, go and do some pelvic floor exercises. What we should really be doing is actually directing them to a service that offers specialist pelvic floor physiotherapy, and they can be taught how to do it effectively. And the evidence has shown if they're taught how to do it effectively, then actually it can be quite successful. And they should really be referred to a course of treatment, which should be available locally wherever you are based. There's not much, it's tricky with the kind of products that you can buy on Amazon and various other online retailers are available. The things that you can buy to help stimulate your pelvic floor, I'm not sure whether there's a huge amount of evidence that supports how well they work, but if it's something that people want to try, I guess that's up to them. But I would I would recommend sort of discussing that with a physio before sort of rushing to buy any of those sort of products.
I guess a lot of this is driven by people being embarrassed, because
and looking for things they can do themselves without having to talk to anyone else about it.
Exactly. And I suppose, each individual woman is thinking, oh God, I really don't want to have to go for a physical examination. And yet the doctor are thinking, it's just a part of the body.
Yeah, exactly. And I always find it's funny. Well, it's not funny. I do feel for women when they come and say, "Oh, I'm sorry, you have to examine me like this." But and nearly every time they will apologise, and I'm often like, "Why are you apologising? This is my job. This is what I'm supposed to do. You don't have to worry about it." But yeah, it's difficult, and I think urinary symptoms, especially, I think there probably is a little bit of a stigma around them. And you sort of think of it as being something that affects older women, maybe, but actually it can affect women of any age, and particularly women after childbirth. They will often be the ones that struggle with the stress incontinence. And I know lots of women who have had babies and, you know, can't go on a trampoline, and you know, and they just put up with that as being sort of normal. And there are things that you can do to help, and I think physio is something that's really, really useful and should definitely be sort of a first line consideration.
Brilliant.
If you've got more of an urge incontinence problem, there are things, there are medical treatments that we can use which can help with that. So these are usually what we call anticholinergic drugs, and they're drugs that actually help decrease the overactivity in the bladder muscle. And there's a few different drugs that are available, some slightly more old-fashioned and some slightly newer ones, and they're all kind of effective. The downside with the slightly more older-fashioned drugs, which is there's something called oxybutynin, which is what used to be sort of classically used, is that it does often give people quite a dry mouth, and that can be quite, you know, it's not a very pleasant symptom to have, particularly if your job involves talking a lot and you get, you know, you get in sort of a dry mouth, it's not overly pleasant. And so some of the slightly newer drugs do seem to be a little bit better from that point of view. And what I would normally say is, if your GP is going to give you one of these drugs, is to try it for about 4 weeks. It might not work instantly overnight, but give it a go for at least 4 weeks and see what sort of effect it has. But if it hasn't helped after 4 weeks, I probably would say you don't need to take it any longer. You know, a 4-week timescale is what we'd normally expect to have noticed a benefit. So if it hasn't worked after 4 weeks, then go back to your doctor and ask to try something different. But if it is effective,
with the different drugs, is it like with different HRTs, different antidepressants, whatever, that they're different enough that you might not get on with one but you will with another one, kind of thing?
Yeah, I mean, I think to a certain extent all drugs are a bit like that. I think everyone does have a bit of variation in how they respond to treatments. Most of them will work because the nature of how they work is very similar. I think the degree of side effects can be quite different from one person to the next. That's probably more of a reason for people to want to change, and that they're getting really sort of significant side effects from it. But yeah, definitely, I think if one hasn't worked, it's definitely worth trying another medication before sort of closing the door on that and saying, well, that's not helped me. So there are a few different drugs available that your GP can use. You know, this doesn't require you to be referred to the hospital or anything like that. Obviously, if you've tried quite a few different medications, then at that point it might be worthwhile your GP considering referring you to the hospital to have to see one of the urogynecologists about other potential options, and that's both for kind of stress incontinence and overactive bladder. One of the other big things that can often contribute to both types of incontinence is a prolapse. So if you are suffering with any sort of prolapse symptom, again, this is why it's important really to have some sort of examination, because you might not necessarily have recognised that there's a problem. But if you have got some weakness in the vaginal wall particularly, that can often impact on your bladder function. And sometimes things to manage prolapses are used to help with incontinence problems as well.
So all in all, if you're suffering with this, go and see the doctor. They're not going to be judge you. There's not going to be any nastiness.
No, definitely. And there's lots of different things that your doctor can try without you having to go off to see some specialist at the hospital. And so there's lots of simple things that can be done that actually can make quite a dramatic difference. And I've seen lots of women who come back and are so pleased that they've actually tried something, because it makes such a huge difference to your daily life. You know, I've had women who, when they go out shopping, they have to plan their day so carefully around where the different public toilets are. And they find it really hard to do anything spontaneous, going anywhere different, because they worry that there's not going to be a toilet there. And to have that impacting your life in that way, when actually there are quite simple treatments that can actually be really effective, it's sad that there's women that are still having to put up with that, really.
Yeah.
So yeah, I would definitely encourage you to go and see your own doctor, and have a chat with them, and you'll be glad that you did, because it will make a difference.
Awesome. Thank you so much, Susie.
No problem. Thanks. Bye bye.